But as I said, thank you for joining us. It's a real pleasure. And I'd like to take the opportunity just to welcome my colleagues who will kind of share the panel with me today. So those of you that don't know me, my name is Michael Knight. I'm the Chief Technology Officer at SCW. Allison, would you like to introduce yourself?
Thanks, Michael. So afternoon all. Allison Nation, Associate Director for Digital Strategy, NHS Somerset. Been part of previous reiterations of PCT, CCG, and now in the Integrated Care Board, but very much thinking about the whole system as an integrated care system. So good to share what we know, and sure we'll have something to learn from today. So I'm keen to learn from you as well. Thanks.
Wonderful. Thank you, Allison. Sophie.
Hi everyone, I'm Sophie Hardesty. I'm the Cybersecurity Risk Officer for NHS Somerset. It's my first NHS role and I joined the ICB in November 2021. So thank you for having me today.
Wonderful, thank you. Great to have you with us. And Arif.
Thanks, Michael. Hi, everyone. I'm Arif Gulzar. I'm the cybersecurity lead for NHS South Central and West CSU. I've been with NHS from last 14 years, and in this specific role, which is cyber, from last 7 years. I manage the cyber governance, risk, and compliance functions within SCW, and which also includes providing cyber consultancy to our customers. Thank you.
Wonderful. Okey-doke. Thank you, Arif. So in terms of what we'll cover today, we'll touch a little bit on the current challenges, some of the historic challenges that we've moved on from and how things have changed. Hopefully a bit of opportunity for some participation towards the end with some questions. Hopefully an opportunity to share some kind of thoughts and insights on what we might see coming down the line as future priorities. But we'll start with really a bit of a retrospective and thinking back to the evolving landscape. So Allison, you and I were fortunate enough to head up to London a good few years ago now to meet who was then the chief exec of NHSX and provide some insights from our world on what he should be doing about cybersecurity in health and care. So that was about 4 years ago. COVID has happened. ICSs are a thing now. So for you, what's really kind of changed in the past few years from a security perspective?
Thanks. So yeah, it's amazing the contrast that we have from what we were, as you say, 4 years ago. It was very much about organisational focus, very much separate cybersecurity plans. It was more about risk management processes, and how did the technology help us protect the data, the security of what we were doing. Now we've had the pandemic, we're very much about an integrated care system. So it's not just about where the GP or the trust is or the hospice. It is now how does one impact on the other. We've got a lot of information flowing between different parts of the services, health and care now. Voluntary sector are part of our community. So really it's, as we know, for cyber perspective, it is, if you've got a cyber risk, it only takes one click on something and that can cascade right around the network. So how do we put in different controls, different mechanisms to help protect the data that we hold, and protect and support individuals in providing the care. So it's a really important change in that landscape, I think, Michael, for what we need to do going forwards.
Absolutely. I think that real change in terms of the players that you might get involved with and the assurance that you might give or seek as part of that system is certainly something that I've seen change kind of through that period. Arif, you're fortunate enough to work around a number of integrated care systems. So I'm really interested in your insights into how you see things kind of having changed in that period.
Yeah, so just to add what Allison said is that obviously threat landscape is significantly changing over the past 5 to 6 years since WannaCry. But what we are observing is the security assurance frameworks, which are basically the regulatory landscape that's also evolving, which is influencing the culture and security posture of healthcare organizations, which is the good news. But obviously there is a lot of awareness now in terms of maturity, which happened over the past 5 to 6 years. as you might have seen, cyber is now on the is the top priority for every healthcare organizations. So in terms of COVID, obviously remote working is obviously changed the landscape again. So it's opened up more opportunities for attacks. Lots of research is happening in the identification of security vulnerabilities, which ties to towards the threat landscape. And obviously, there is a lot of shift towards artificial intelligence tools as well to address those vulnerabilities, because obviously we used to have traditional tools, which was considered to be as overhead, basically for the operational teams, what we have seen. So that's why there is a shift towards artificial intelligence, which can reduce basically that overhead, and it basically allows us to acquire or attain that efficiencies basically.
Thank you, Arif. I think that's really interesting in terms of where those tools are changing. I think that's really kind of feels to me like it's very much in response to really the next thing that I'd like to actually move us on to, which is really that workforce piece. So through COVID, we've seen lots of changes in terms of workforce, and it feels very much like an employees market at the moment, and particularly for industries where it's difficult to find talent. So workforce is one of those really key challenges in terms of having enough skilled people, and looking at new ways of being able to fill some of those gaps and then augment them with technology and like artificial intelligence, etc. So I think that's a really nice link into kind of the next question that I had. So Sophie, great to have you with us. So through this kind of period of change that we've just talked about, you've, as you mentioned at the top, you've kind of started your career in cybersecurity. Can you just share a little bit about the kind of the journey that you've been on since November 21?
Yeah, of course. So I don't really have a technical background at all, to be honest. I did an undergraduate degree in history and economics, and then I did a master's degree in international security studies. So it was really in my master's that I had more of an interest in sort of risk management, working within the public sector. So from there, that's obviously where I found this role. I thought it would be a really great opportunity to get into the cybersecurity field without having sort of that technical background. And now that I've been in my role for some time now, I've just recently completed a training course for CompTIA Security Plus, and I should be taking my exam soon. So yeah, now I've got a bit more of a technical kind of underlying baseline. So yeah, really looking forward to where my career can go next.
Wonderful, Sophie. I think that's really insightful, and I'm sure when I kind of ask Arif a little bit about some of the things that we're doing in SCW, there'll be lots of parallels there in terms of that journey that you've been on, and how you've kind of come into that in terms of a technical kind of skill set level, and how that's kind of evolved. So I think that's certainly really interesting. So Arif, from an SCW perspective, what's the focus from a cybersecurity workforce perspective?
Yeah, so the workforce is definitely, as an NHS organization, we are not different in terms of facing that challenge. So yeah, a UK-wide there is a UK-wide shortfall of cybersecurity professionals, making it really challenging to hire and retain experts. So what we have got is a comprehensive hiring, training, and retention plan, which really helped our organization to overcome that. So we offer graduate schemes, apprenticeship schemes, and also secondment opportunities to the staff. So that really helped. But again, that's still a challenge. And in terms of continual professional development opportunities to our technical staff, we provide that using different training platforms and industry best practice certifications like ISC2, ISA, CA. So all of those are very much recognized. I have good certification, lots of them, to be honest, and that's why, as part of the progression, that's my focus, is that we do invest in people when it comes to training opportunities and development opportunities internally.
Brilliant. I think it's really interesting that point, and we've touched on how we lean quite heavily on graduate schemes and apprenticeships and those kind of things. And I think from my perspective, they're really successful. They're absolutely, there is an investment up front in that, in terms of kind of time and support. But in terms of that journey that we see people go on, it's really impressive to see just how quickly people can pick up in this world, if you provide them with the right support and guidance. So reflecting on probably the first graduate that we took into our security team, probably 3 and a bit years ago now, to see how quickly they progressed. I know they were writing better code than me within about 2 minutes, and scripting things and all sorts of really good stuff, almost immediately. So they're having that kind of desire and commitment to learn, as well as the right support, is really key. And I'm certainly I'm a massive advocate for bring folks in, give them the support, guide them, and kind of give opportunities to learn new things. I think as a broader organisation, that's pretty important to us, as well. So it's really interesting. We've kind of spent 10 minutes or so talking about kind of cybersecurity in general, and actually we spent quite a lot of time really talking about people, and talking about, and Allison touched on earlier, that potential point of vulnerability in the organisation really being your people. Arif, you reflected on there the aspects around, well, there are lots of different technologies, but we need the people to operate them, and there's also another really big people aspect, that, and I know from a Somerset perspective, you're spending a lot of time and putting a lot of commitment into around the aspects of kind of security culture. So security culture being everybody in the organisation having a stake in security. I think through the COVID period, we've seen just how important data and information and systems are to ensuring that we can provide the best care possible for patients. So Allison, I'll come to you. How have you approached the challenge around kind of developing a security culture within your organisation and the broader system?
So it really started with Sophie joining the team and finding someone who didn't necessarily have technical skills but could interpret what the tech folk were telling us. So Arif, very technical with the team, fantastic support, but how do we land that with our executives, with the people that we're working with? And I'd say it's just not in the ICB for us, it is about who we've got working alongside in digital social care programs, who are in care homes, who are in general practice, in pharmacy, voluntary sector. So Sophie really came in with that ability to help us move away from the risk management process into a process where we look at people, process and the technology. So that's how we now structure our cyber security action plan. Deliberately starts with people. So who are the tech folk? That's an easy one. Who are all the others who are using the technology and the systems that we're introducing? And there are more and more systems and tools we're bringing online. So how do we help assure that those are secure in their nature, that people understand that they've got their own individual responsibility? So we've worked with the corporate team around kind of records management, and they're signing up to processes during induction. But ongoing work, and Sophie in a minute I'm sure will talk about digital champions that we've set up within our organisation, and I'm hoping as we more become an ICS we can share that model across the system, so that we're sharing the ways of learning, of tips and hints on how to do things. Sophie's come up with some other things around screensavers that we're using that just can keep that continual method of reminding people to think about their security. We know there are a lot of spam emails coming through at the moment. It's very easy during Christmas or other peak purchasing periods, shall I say. So there's a personal responsibility and impact for them as well, not just in the workplace. And I think that's been the shift that we've seen. So to help with that culture, so recently engaged with a national offering from kind of fraud security people around running a board session for cybersecurity. So a little bit of playtime with Lego, but it helped land the message around a scenario of, it was everybody's responsibility, from the executives through everyone else in the whole organisation and the system. So yeah, quite a lot of information in there, Michael, but it really is about that whole culture piece, that everyone's got their part to play in this, I guess, is the headline. But whether you want to bring in Sophie around digital champions.
Absolutely, that was where I was going to go to next. It'd be great to hear about the kind of the digital champions and how you use them to help promote your kind of security culture.
Yeah, so as part of our cybersecurity action plan, user training and awareness was a real focus that we wanted to kind of work on. So I came with the idea of creating cybersecurity champions. So each there's one member from each team within our organisation who I meet with on sort of a bi-monthly basis. So it's not too much time out of their normal working day. And we just catch up on the latest cybersecurity threats, any reporting procedures that they need to know, and just some general cybersecurity advice that they can then share directly within their teams. Just making sure that we have that link with all parts of our organisation to make sure that everyone has sort of the same level of awareness of the cybersecurity risks that we're facing. And yeah, as Allison mentioned, there are some other sort of cyber awareness things that we've been doing. So we have got screensavers, which just have general kind of cybersecurity posters and things, just to keep it sort of in people's minds as they're around the office or at home. But I also run monthly cybersecurity workshops, so that'll cover topics such as different types of social engineering. Also, we've spoken about ransomware and the impacts of ransomware on health and care systems. We've also looked at sort of cybersecurity at home as well. So obviously, if you have a good culture at home and you're really secure about how you're using your devices at home, then that also relays into work as well. So yeah, also be looking at those. We also just share weekly comms with everyone. So that will cover things such as any of the latest cyber attacks that people might have seen in the news, just to raise awareness of that it is happening sort of all the time. Also making sure that people know how to report phishing emails, how to report more serious cyber incidents, working with our emergency planning teams to make sure that we've got business continuity plans in place, and communication routes within smaller teams, and just sharing general cybersecurity top tips as well, just to raise the profile of cybersecurity across the organisation.
Wonderful. Lots of really hard work there, Sophie. So no, well done for getting through all of that stuff. And I think that people change piece is the piece that really needs the commitment and the that ongoing maintenance and perseverance, which can feel more difficult in sometimes than others. Particularly as you're responding to things that happen that are surprising, that you kind of expect might not crop up, having put all that hard work in. So I think lots of really useful insight there, and some ideas for folks to potentially take away. So Arif, as I mentioned earlier, you work with lots of different systems across the whole of the South. So from your perspective, what advice would you give organisations about developing a security culture?
Thanks, Michael. So my advice would be, to be honest, there are 7 steps. It's started from the board level. So started from the board level training, which will help definitely promoting a good cyber hygiene from top to bottom. Then staff training, staff awareness training is really, really important. You can also perform simulation phishing exercise, which is again is a national offering from NHS Digital, which really helps basically to test the effectiveness of that training basically. And also it just it just makes that awareness about how to spot phishing and social engineering and all of that. Then also what's really important is when it comes to communication is explaining the staff basically what's at stake. That really helps because if you can explain the consequences, if you can explain the implication or risk, the likelihood is obviously there is going to be an acceptance on the other side. Fifth one is the consistent and regular awareness bulletins. So, the message has to be consistent and there should be regular comms, just to remind basically the staff that, what they should be doing in terms of, what are the do's and don'ts. Sixth one is encouraging and promote, and this is really important. It's incredibly important. Is encouraging and promote a culture where staff feel empowered to report security issues and incidents and risks, so that we can do the trend analysis and we can, if we need to bring in basically a targeted approach, we can look at it. So that's incredibly important. Is the promoting that culture where where staff feel empowered to report those incidents and risks. And the seventh one is cyber incident response exercises, so which is business continuity basically exercises to have perform annually, because we know the threat is real, and we know that none of the organizations or healthcare organizations are 100% secure. So I think what really matters is that how quickly we can respond to an incident and recover from it basically. So I think that's why it's really important to do that rehearsal, which is basically cyber incident response exercises, or BCPs, business continuity plans.
Thank you, Arif. And I think reflecting on your point there around no health and care organisation is secure, I think I'd take that one step further and say no organisation is secure. So even if we go back to WannaCry and we think about the root cause kind of exploit behind that was a national security agency thing that kind of found its way out into the wild and was then used for purposes that we wouldn't want it to be. So I think pretty much every organization has people, therefore every organization has a weakness in some form. I think I'd really reflect on your point around point 4 around being really clear about what's at stake. So I was speaking to somebody who's a CIO in education, and actually the approach that he's taken is he doesn't call it cybersecurity, he calls it data safeguarding. So because in education, safeguarding is the absolute number one thing that is very much at stake for their people, and everyone takes safeguarding incredibly seriously. And therefore he's kind of taken that concept and he's made it very clear what's at stake in a way that is very accessible in that context and to the people that he's working with. And I thought that was a really, really great idea. So certainly that was one that I scribbled down, and I'm pretty sure I spotted Allison to scribble that one down as well. So I think that real kind of degree of what did this mean to me is absolutely key, because many folks may not see security as part of their job, but they will see all the impacts if we don't get it right. Wonderful. Anything else from the panel that we'd like to add on that one, or should we throw to questions?
I think it is that changing the terminology. So what lands with the people you're trying to link with to help them understanding what they're coming from and what their concerns are. There we've got phrases of data security and protection, cyber security. Yeah, I do like data safeguarding. I think that gives it another different look on it, doesn't it? But essentially it's that shared language and that space of understanding. So thank you.
Absolutely. Wonderful. And at a really, really helpful time, I can see a hand, which is incredibly helpful because I'm getting the wheel of doom in the chat window. So Jane, thank you for putting your hand up and saving me from the wheel of doom. Would you like to jump in there and ask a question?
Yeah, hello everyone. So I'm Jane Cowans, head of cybersecurity supply chains at NHS England. As the title says, my question is around your supply chains and what you're doing to reduce the risk from suppliers.
Well, I think I'm happy to start off on that one. So I think one of the things I would be remiss not to mention, having been involved in it, is the digital tech assessment criteria. So in terms of making sure that we're referring back to that in terms of the those 6 aspects, particularly around cybersecurity, but all of the other 4 domains in there as well, and being very clear around making sure that the organisations that you work with have something like Cyber Essentials or ISO 27001, so they're fit as an organisation. Also looking at, are they doing annual penetration tests? So their specific app, is that secure, and how are they demonstrating that? Things like multi-factor authentication, making sure they have appropriate controls around making sure that they can defend against denial of service attacks through kind of load testing, etc. So I think the really key thing for me is that actually from a health and care perspective, I think there's a lot of stuff out there in terms of guidance and frameworks that we can use. So I think at an absolute basic level is really starting to look towards that, and I know that's certainly a big push from NHS England nationally and regionally to really start to look at that supply chain and work the way through, as well as a number of other different work streams that are part of the new Cyber Futures framework, which is kind of emerging at the moment. So really, I would probably start with that digital tech assessment criteria and have a baseline level of, okay, well, who will we work with, and what do they need to be able to demonstrate. Now, I think probably the best guidance I could give over and above that is don't believe that because an organisation works with another NHS organisation that they automatically meet appropriate standards. I did a number of assessments centrally on DTAC, and I was really surprised at the kinds of organisations that couldn't demonstrate good controls in terms of security, or thought that it just didn't apply to them. So yeah, I think my advice really would be, and I think I shared this the other day, it's okay to trust, but you must verify. So be really clear about what your standards are, and make sure that you verify them as part of that kind of onboarding. Now, that is really hard. Through COVID, what has happened is people have needed to change very quickly in terms of how they do things, and they've lent on technology much more. So it's kind of, with cloud, everything has become much more kind of democratized. Now someone can go out and buy a thing and pay a subscription and spin something up, and that's a risk to manage for sure. So we're working really closely with our procurement colleagues within SCW to actually make sure that we've got some of those controls around, okay, well, someone wants to go and buy the system, should we be allowing that? Does that meet the relevant standards, etc.? So there's always that risk of kind of what you might call satellite IT within organizations, and that really needs to be managed ideally kind of in conjunction with your procurement folks, so you have that check and balance before someone goes and signs a contract. And suddenly, I recall in the previous organization, somebody coming to me and saying, okay, great, we've bought a new cardiology system, when can you install it? And we'd had no involvement in any of the assurance of appropriate standards around integration, security, all of those things that you would find in the digital tech assessment criteria. So yeah, that would be my view. That's a really long-winded explanation, but it's sadly, supply chain is not a particularly straightforward one, unfortunately.
I'd back you up on a couple of those points about not assuming just because they're in one NHS organisation or care organisation already, do your own checks. I think that's really important, because we all think differently. Different things will be important to us, whichever setting or experience we're in. The other thing I would add, you've mentioned trust, but I'd actually say it's about trust and working relationships with suppliers, so that they're partners and understand the potential risk that you would then share by working together. So those would be the 2 bits I would add to keep the answer slightly shorter.
Wonderful, thank you, Alison. Anyone else that wants to pop their hand up? I know we're slightly over time, but I'll give an additional opportunity for anyone that has a burning question.
There's one about magic wand, and I would say it's all about investing in people. I think it's really important. So, you know, I found Sophie, we found Grow Our Own. You know, the trained resource isn't necessarily out there. It is competitive. So yeah, take the opportunity and the talent that's there, support, invest in it, and then give them a few tools and capacity, creativity to address the thing. As I think the technical bits are kind of in play already, but the people part for me is the bit I would love to change and continue to change. Sophie's doing a fabulous job so far. So
brilliant. Joseph, can see you've got your hand up. Did you have a question?
Yeah, thanks so much, Michael. Yeah, I really want to commend the team for putting up this webinar for knowledge sharing. This is key and very important to support workers across board. I'm just asking if it's the cybersecurity and having the system secured in the different facilities. You might be looking at the stakeholders and how they interact with the systems. Is there any form of awareness to the stakeholders on how they interact with the system? Because I believe this will minimize the attack rate, if any should be, at any point in time. If the stakeholders or the users of the systems are aware of the things they do not need to do to expose the systems to risk. Do we have such things in place? Thanks.
I think so. I'm happy to start. So I think from my perspective, it's really about education and the real basic fundamentals. Thank you, Vanessa's just messaged me in the background about the free chat questions, which I still can't see because I've got the Wheel of Doom. So I'm struggling to get to those, but perhaps what we'll do is happy to share some answers and thoughts on those perhaps after. Yeah, put that one out there. Oh, I can see them actually they're coming in now. Wonderful. I thank you, Nikki, for the comment there around actually making it relevant and important. I think that follows on really from what Joseph kind of asked there is around how do we make it relevant. I think it's really challenging in health and care in terms of what level do we go to, and how do we make it relevant, and how do we make sure that we create enough time but not create a burden on people in terms of that education. Now I think in an ideal world, I think our standard across health and care is you have to do some training once a year. Everyone has to do their data security training. That's part of the data security and protection toolkit. In an ideal world, and I know many other organisations in other sectors use products that kind of have like a drama series around this security thing, and it creates a really compelling story that's very relevant to their organisation. And it comes through on a monthly basis, and evolves, and it really keeps interest in people. I'd love to see that continued commitment. Is that a challenge when if you read, if you see what's in the media or read what's in the papers around the operational pressures? And I think that's a really hard balance to find in terms of ensuring that people are aware and do not contribute through things like making sure they don't click on links for phishing, etc. But there is a real balance at the moment, and it's a tough one to find. And I think sounds like through using those champions in the way that Sophie is, that is a real benefit, because it will be that person that when they see something that they don't think is quite right, they will educate on a spot basis, and that is a real benefit of developing that security culture, because you cannot police everything, but if you build that network of people, they will, to an extent, they will police it for you.
And I think just picking up from that, where we've been back in the office a little bit, we've had people come into the office go, I've had this, it doesn't look quite right, it doesn't feel right. So we've been able to help work through that fear factor of what have I done, what have I clicked, and that kind of peace of mind of, okay, let's make sure you're disconnected from the network, some of the logical things we need to do. So some of it is just working with people and being a bit of a face that to be mindful and be aware, but worry about it and deal with it in a constructive way. I think it's nice to be able to support that way of working.
Wonderful. Okie doke. And just so we need to wrap up fairly soon. Helen, in terms of career change into cybersecurity, I think my best piece of advice on that would be to really get out there and speak to people, build some relationships. There are no shortage of people that are looking to recruit into cybersecurity roles. So my advice would be get out there, speak to people. It gives you an opportunity to develop your understanding and appreciation of different aspects and what might be a good angle for you, but also opportunities either can come directly or indirectly off the back of that. So really would just advise you kind of build your network, speak to people. It's an arena where I know folks are very generous with their time and insight, so that would be my main advice on that one. Great. And I think
I'd say reach out to your local cyber team. Sophie doesn't have a particularly cyber technical background, as she shared, but sometimes it comes from an administrative wanting to support the healthcare industry. And I would say if you've got clinical knowledge already, that's a really good starter. So do reach out to your local contacts and explore what might be possible. Local colleges, there's lots of online training pieces, aren't there? So it's just doing some reading around it, a bit of exploring. But good luck with it, Helen.
Wonderful. Okie doke. Well, thank you firstly to my colleagues on the panel. Really appreciated your insights. I've certainly taken quite a lot away from that in terms of how I'll apply things in my day-to-day work, and I'm sure that the folks that joined us will do the same. Thank you to everybody that joined us. It was wonderful to have you. Thank you for your really insightful questions, and hopefully we'll see you again soon. Have a great day, folks.